want to welcome now Michael Shih. He is the COO and CFO of Curogram. That is a telemedicine and messaging platform company that is offering virtual clinic telemedicine free to children's hospitals and other institutions during this pandemic. Michael, thanks so much for being with us. First off, what has demand been like? I have to think things are just skyrocketing during this pandemic for a service such as yours.
Absolutely. It's been really unprecedented, and the team is working literally 20 hours a day responding to the demand right now. As you can imagine, telemedicine a month ago was a niche market with minimal demand, and overnight it has become a need of every doctor in the country and the world.
Michael, what about your hiring plans? How have you hired, and what do they look like going forward just to satisfy all this demand?
So we are actively hiring for the company right now, and really what we're focused on is partnering with larger implementation, especially software integrators and implementation companies, as we offer our solution to the hospitals. And really the COVID-19 response product that we announced this week is geared towards helping these hospitals streamline their operations in screening and testing. And to do that, to get that out to the entire country, or if not the world, we're partnering with some large implementers.
Michael, you mentioned that you've seen demand grow just basically overnight. Can you tell us, do you think that this shift will be one permanent once this pandemic is over?
I think so. I think this is a paradigm shift in our marketplace, in telemedicine at least. And a lot of it's driven by the reimbursement rules. And so assuming those rules continue to stay where they are today, or at least evolve in the direction that they have gone to today in this crisis, I think you're going to see a vast majority of doctors shifting maybe upwards of 25 to even 50% of their volume to telemedicine in the future. And if nothing else, all these physicians and medical practices and health systems are going to need to have these communication mediums in place as an alternative, just to be prepared for any type of crisis like this in the future.
So, Michael, this is a real layman question here, but if this is being done by telemedicine, right, where people are not being able to really be with the same person in the same room. And we know that when we are triaging these COVID-19 patients, things like taking their temperature is part of the process. How is this happening virtually right now?
So today, that is definitely a challenge, but in the future, there are a lot of technologies that are coming to market and a lot of wearable devices and things like that will be available or are available today, but I think widely will become more distributed amongst consumers in the marketplace in the future. And when you have those consumer products in the hands of patients, that enables physicians and health systems to do all sorts of monitoring and physical exam work that they may not have the ability to do today. But I would say in today's market, it's doing the best they can with the tools that they have in hand. And a lot of it is just getting the face-to-face consultation, understanding, still having that connection with the patient to understand what is their issue, what are they dealing with, and the diagnosis a lot of times not just the physical exam, it's the communication and understanding the patient's symptoms directly. And so, and you've seen all types of creativity with doctors using telemedicine to manage patient care.
I know you're an LA-based startup. It's hard to see past tomorrow, let alone 6 months to a year from now. But when we do come out of this pandemic, and we will, is entering the public market something you are considering for Curogram, and what might that timeline look like?
That's always been a potential opportunity for us, and I think that just got accelerated in the last 30 days, given the demand and growth that we've seen. I think we have two core things that we're working on today. One is our communications, end-to-end communications platform for everything from two-way texting to video conferencing or telemedicine. But in the last 30 days, we've really been focused on configuring our platform specifically for COVID-19 crisis response, because we think there's a huge need for these hospitals to streamline this process from screening to telemedicine visit to managing a testing site. And we're working with a hospital in Houston right now doing that real time. And I think that's going to give us an opportunity to help save thousands and hundreds of thousands of lives if we can get this solution to the marketplace. And in our telemedicine category, we see that as a paradigm shift that is going to be a long-term business opportunity that's going to drive revenue growth, adoption for years and years to come. And so it's a great business opportunity. But on the COVID-19 side, our response platform there, we see that as a life opportunity. I mean, this is a once in a lifetime chance for us to, as a team, to participate and help make a real impact on the world. So, how often do software engineers and entrepreneurs get the chance to, be on the front lines of helping to save lives? And a lot of us feel like this is our chance to be like the firefighters at ground zero on 9/11, and we're working around the clock to try and help hospitals deal with the crisis.
All right, we're going to leave it there. Michael Shih, CFO and COO of Curogram, thanks for your time today.